Good morning, everybody, and thank you for joining us today. Today, we're going to talk about one of my favorite benefits in New Jersey, the paid family leave benefit. And as we advocate for making New Jersey a better, more affordable place to age, this is, I think, one of the best kept secrets in New Jersey. It really is an important program that helps people serve as caregiver, that helps them protect them financially, and enables family members to care for their loved ones at any age. So we have with us today our dear friend, and once I figure out how to advance that slide again, Yarrow, well, there we go. Yarrow Willman-Cole, the Workplace Justice Program Director at New Jersey Citizen Action. So I'm going to turn this over to you, Yarrow. We are going to have questions. We have plenty of time at the end for questions. So if there's something that in particular you want to ask about, drop it in the chat, and we might like stop and address it then. Otherwise, try to hold your questions to the end, and we're going to stop the screens, take everybody off mute, and hopefully have a real discussion about this program. So, Yarrow, I turn it over to you.
Awesome. Thank you, Kathy. Hi, everyone. Yeah, there's my bio. A little bit about my background. I've worked for over a decade on the Time to Care Coalition, which is, how we've worked closely with Kathy and lots of different organizations focused on passing policies that help workers, help individuals, help families be able to afford to take time to care for themselves and for their loved ones. So you can go to the next slide. I'll tell you a little bit about my organization so that you're familiar with New Jersey Citizen Action. We actually combine political advocacy, electoral campaigns, public outreach, community empowerment, all really focusing on how to make a difference in the lives of everyday New Jerseyans. So we also provide a range of services. So I want to just show you some of the services in the next slide. We do provide free tax prep, financial coaching, first-time home buying counseling, fair housing, and free healthcare enrollment assistance navigation. So that's a list of some of our services. Those are free to the public. And you're welcome to go visit our website and check out those, as well as just knowing the issues that we focus on in terms of our advocacy work. As I mentioned before, obviously paid leave policy, but also we work on healthcare, consumer protection, good government, electing progressive leaders, and we work on some other issues like the Fair Auto Act. You can go to the next slide. So we're going to go ahead and get into what it is. But I would like to just ask you all how familiar you are with paid family leave and if you have taken it or helped someone take it. You can pop that in the chat. Just let us know if you have some familiarity or if it's kind of like, nope, not really sure. It kind of rings a bell. I know a little bit about, what it might mean when you talk about FMLA. So let us know in the chat if you are familiar or not familiar at all, and if you've helped someone take it or take it before. So yeah, that'll give us a sense of, how much information we need to provide. I think we're going to go into the next slide, which is really just what it is. So what is paid family and medical leave? So paid family medical leave is wage replacement. When you stop working, when you take leave to care for loved ones, and those loved ones are coping with mental or physical health issues. It's also the same thing when we talk about bonding with new babies, adopted, and foster children. And if you need to take time to cope with issues related to domestic or sexual assault, or care for somebody who is coping or dealing with those issues. So those are actually specifically wage replacement that falls underneath the description of family leave. When we talk about medical leave, we're talking about someone's own health, when they need to stop working and receive some pay for their own mental or physical health conditions. So we kind of combine them in the description of family and medical leave. Next slide. And I should just say, you might hear other terminology like FMLA leave, paternity leave, maternal leave. It's all the same sort of bucket. And sometimes we just say paid leave, but the actual kind of way we try to encapsulate it all is paid family and medical leave. Okay, so I wanted to also ask you all, And this is a section where you could come off mute and chime in if you feel comfortable. Why does paid leave matter? What happens? What is the situation that people may be facing when they don't have paid leave? So give me some of your thoughts about why it matters. Well, what happens when you don't have it? Trying to make it interactive.
I'll jump in and start. It puts someone's own financial security at risk, their long-term risk. If they have to give up working, give up their income to care for someone, not only are they losing their income, but then they're also taking on those extra costs that are related to caregiving.
Yeah, when you have no choice, when you have to stop working because of health, either your own or someone who you love, who you care for, you don't you don't have time to think about whether or not you're going to get benefits sometimes. So if you don't have any paid leave, you're going to lose that income. And that's going to really create a destabilizing financial situation for you. Yeah. What else? Maybe someone has been through this, or you've heard of stories where someone didn't have time.
Yeah. Someone put in the chat job lost, which is
They-
true. And then there's a question, how much do you get paid on leave? And we're going to get to that, Sarah, we'll get to that question coming up.
Yeah. So we can go ahead and go to the next slide. I think you already mentioned the financial insecurity. So we're talking about lost wages or if you just lose your job and how long it takes you to get back into the workforce if you're at that stage, where you're still trying to earn wages at some point after you taking leave, that can have real serious long-term ripple effects. But also just in general, we have to think about your own stress. Like that can really lead to even further physical, mental, and emotional health deterioration. So just that stress of having to figure out, how to cope with taking time off, the financial impact it can have health effects too. And then just the pressure from employers or the pressure to earn wages might actually prevent you from taking the time, even though you need to. So you're juggling a lot, trying to figure out how to manage someone's health and caregiving needs. And that can really create a lot of pressure and lead to continued further worsening of health. And then also don't forget, if you can't take paid leave, then you may not be able to make your medical appointments and really have your care, the care needs addressed. So that can lead to further worsening of health conditions as well. So yes, next slide. The other thing that's when we think about it kind of on the personal level and the household level, but also research has shown that paid leave is essential to the health and well-being of individuals and their caregivers, as well as the overall public health, and that we should actually consider paid leave an important social determinant of health. So these are all these factors beyond just how we care for our health needs, what our medical needs are. These are impacts that have actual serious consequences on our health, but they're not related to the medical care that we need. So paid leave is a really serious factor. And it's really important when we think about aging policy, because paid leave does provide this lifeline to older adults in the workforce and those who are not. So we have to think about these overall benefits. We talked already about, how it impacts your economic well-being, the overall economy, keeping people in the workforce when they need to be working, but receiving some pay when they need to stop working for a time. And then it also can just reduce disparities in access to care and health outcomes. And also paid leave when it's connected to job protection and FMLA requires that you are keeping your health insurance, which is of course critically important when you're dealing with your own health needs, but also not wanting to risk your own health when you stop working and losing your health insurance. So having paid leave can help you retain your health insurance. And then there's also benefits for employers. Employers can retain their workforce, reduce turnover costs. It can really actually support employers' bottom lines, boosting the health of their workforce and improving their workers' morale and their productivity. And I think I mentioned this before, but it's important to remember that it can address racial and gender inequities in health, as well as in the workplace and in overall earnings. We do still have a gender pay gap here in the United States. Yeah, I mean, when we think about older workers, including many who remain in the workforce out of financial necessity, they need access to paid leave to manage their health issues, and they don't want to jeopardize their job or their paycheck. And for older adults who no longer work, they're relying often on care from their loved ones who also are struggling to work and deal with family responsibilities. And paid leave really does increase the likelihood that workers can provide care to their family members, which in turn can lead to tangible health benefits for older adults and increase their ability to age in place. Next slide. So, what do we have in the United States? We are still one of the only countries in the world that does not provide a national right to paid family and medical leave. And this is a glaring gap in the law that does harm older adults. You can see here in this map, the US is the only high-income country without national paid leave, and only 6 countries in the world with no national paid leave. So these are countries like Papua New Guinea, Suriname. These are Pacific Island countries, many of them that don't even show up on the map. So here's the United States, right? We see actually 174 countries offer paid leave for personal health issues. We are very far behind. What we do have, you can see in the next slide, excuse me, is FMLA. So we've had FMLA now for just over 32 years. This is just job protection when taking leave, and it provides eligible workers with up to 12 weeks of unpaid job protected leave, not paid. But even when we talk about job protection under the FMLA, half of workers are not eligible for paid leave. And the folks that are eligible for paid leave, it's estimated that nearly 2.6 million of those workers each year, when they need leave, they can't take it because they fear losing their job or they don't have paid leave. So FMLA is still pretty inadequate as a national benefit that covers all workers regardless of where they live and where they work. Next slide. Luckily, here in New Jersey, and this is where, Kathy introed us, this is not a secret, but a lot of people are unaware that New Jersey was the second state to pass a paid family leave program. And it's actually been available now for nearly 17 years, when it was first originally passed in 2008 and went into effect in 2009. But since then, we've seen more and more states, now 13, and the District of Columbia, that have also joined us in offering paid family and often medical leave as well. And next slide. I just always like to pause and make sure everyone knows a little bit of the history here. How did paid leave come to exist? Well, we worked together advocating, sharing our stories, talking to lawmakers, talking about the importance of paid leave, all the reasons that I just described for you before. And so we were able to pass paid family leave. We were the second in the country, as I said before, 2008. And then New Jersey's earned sick leave became law. We expanded paid family leave in 2019. And just this year, we've expanded job protected leave. So I'll talk a little bit about that in a second. But I can't ever miss the fact that my now 7-year-old is that baby on the little flyer there. So that was a while ago. Next slide. Okay, so let's get into it. In New Jersey, when we break it down, we're actually looking at 2 paid leave programs. As I mentioned before, we have medical leave. Paid medical leave actually falls under a program that's often described as temporary disability or short-term disability. But when it comes to the state benefit, we do use the terminology or the abbreviation temporary disability insurance, or TDI. And then the paid family leave program, which is the newer addition to paid leave, 2008 that it was passed, as I mentioned, family leave insurance, or FLI for short. So that's how we kind of think about these programs. They are together supporting people in the safety net as a public policy, and also they're separate in terms of how you think about using them. And so I'll unpack this now for you a little bit more. The next slide. What can paid family and medical leave be used for? So medical leave is your own physical or mental health condition, bonding with a new child, birth, adoption, or foster, which falls under family leave insurance, coping or caring for someone dealing with issues related to domestic or sexual violence, and then caring for a loved one with a physical or mental health condition. Those last three fall under FLI. Let's talk a little bit about caring for a loved one. The next slide. So what we see here is that you can actually use family leave insurance to care for your family or any loved one who you define as family with a physical or mental health condition. The important thing to be aware of when you're taking leave to care for a loved one, you do need to have the healthcare provider certify their health condition. So right away, your relationship with the individual that you're caring for is close enough that you have communication and access to be in touch with the healthcare provider. So you're somehow in a relationship with this person enough that you are communicating about their health needs, talking to the healthcare provider. And I always like to mention, you can also use family leave to care for a loved one outside of the state or even the country. So you can be traveling to another country to care for a loved one. The crux there is, of course, again, still having access to that healthcare provider so that they can fill out the paperwork necessary and certify the health condition. And this is a form that is on the state website, myleavebenefits.nj.gov, that does provide guidance for medical providers so that they understand how to assist individuals applying for family leave insurance and certifying for that claim. Next slide. So I do want to also just remind us the definition of loved ones. So when we talk about caring for a family or a loved one, again, it's anyone who you consider to be family and an individual with a close association equivalent of a family relationship. So you do not have to be related by either blood or marriage. But the law does also specifically list child, spouse, parents, siblings, grandparents, grandchildren, in-laws, and it says specifically any blood relation or chosen family. This is new. This was expanded in 2019 when we expanded the law. It did previously only limit you to your immediate family and actually only to caring for children under the age of 18. Now, if your child is an adult, you can still take the leave to care for them. So this was a really important expansion in the program that a lot of people are not familiar with or aware of.
Yarrow, I just want to jump in for a clarifying point that was put in the chat. So if you're out of New Jersey, the person you're caring for can be out of New Jersey. The doctor that signs the form, it doesn't matter where that doctor is.
That's right.
Thanks.
Yeah, and when you get into the process of applying, you actually can do it all online, and your care provider can certify the claim online. The process does have the website now does have translation capacity, but it is somewhat limited when it comes to the certification. So, that's one barrier that folks may need to be aware of if they're in another country with a language other than English. Yeah. So we can go on to the next slide, and I'm going to unpack a little bit more about who is covered and how you're eligible. So the thing here I like to just emphasize is most employees, most workers in New Jersey are covered in the family leave insurance paid family leave program. So in New Jersey, there's really very few exemptions. If you are a federal government employee, you may have coverage in some other capacity, but you will not be participating in New Jersey's paid family leave program. If you do not work physically in New Jersey, if you work from home in New Jersey, it doesn't matter where your employer is located. It's about where you are based, where you are working. If you work in multiple states, but you are working in New Jersey, you should have your pay deductions, your payroll deductions be counting you as a New Jersey employee. And I'll get into that in a second. But the point here is just, if you don't work at all in New Jersey, then you are likely not covered. But some amount or some level of working physically in New Jersey should in fact cover you. Faith-based organizations are exempt from participating. So if you work for a religious institution or a school, you may not be participating in this contribution, the family leave insurance. And if you are not technically an employee, if you're an independent contractor or a 1099, but I always want to mention there is a lot of misclassification happening as we are even seeing some lawsuits being brought by the Department of Labor with firms like Uber and other types of employment. There is the need to kind of review sometimes how you are classified. Because if you are set up as a 1099 independent contractor, you do not have any safety net. You do not have access to unemployment, family leave insurance, or temporary disability insurance. So it's just important to be aware of if that is the correct classification for your type of employment. For temporary disability, New Jersey's county and municipal employers do not have to participate. So this is a lot of public school staff, teachers, employees that work in public schools, but other levels of county and municipal government do not have to participate. But this is not the case for family leave insurance, only exempt in terms of the temporary disability. So that still means the majority of workers that are paying payroll contributions in New Jersey are covered. So there's fewer exemptions than people often realize for this program. And people often don't know that they are contributing because it's a small amount that is deducted from your paycheck every month. Just like when you look at all your taxes, it is a very small amount. And sometimes it's not coded family leave insurance. Sometimes it's actually added to disability. You may not see it as a separate deduction. So that's not really always a helpful thing to look at when you think about if you're participating. But now that you know this, you may want to look at your pay stub and see if that deduction is happening. And if for whatever reason it isn't happening, if something has gone something has been done in error by your HR or by your employer, it can be corrected. But this is not something that you have to opt into ahead of time. It's an automatic contribution that is coming out of individuals' paychecks every year. It's set up for you, just like unemployment.
Yarrow, I want to go to a couple questions in the chat. We had a couple questions about part-time employment. Are you eligible?
Okay, let's actually go to the next slide because I think this will help. So that's in terms of who's covered, who's exempt from the program. As you saw, very few exemptions. You do still have to meet minimum earning qualifications to actually be able to be eligible to receive the benefit. So this is a qualification that's based on what you've earned at any New Jersey covered employment. So if you work multiple part-time jobs, or if you've switched jobs, if you've left an employer and you're working now at a new employer, you are going to take all your earnings in New Jersey to see if you meet these minimum requirements, which are that you've worked either 20 weeks in New Jersey, earning at least $310 in those 20 weeks. So maybe one week you earned only $200, but in another week you earned $400. It's whatever week that you worked in New Jersey earning at least $310. So once you hit 20 weeks earning that amount, you will qualify. Or you can also look at your combined earnings, and it's a total of $15,500 that you've earned at any New Jersey covered employment in the base year before you take leave, before you're looking at applying for leave. The base year is about a year and a half. It gets a little confusing for folks because technically it's the first 4 of the last completed 5 quarters. And quarters are when the employer is reporting wages to the state before someone takes leave. I just generally kind of round it up for you and say it's about a year and a half before you take leave. If you are very close to hitting that 15,500 and you're not sure if you're eligible, there's a chart that you can go to on the Department of Labor's website, and you can look at the timing and how the quarters sort of backtrack it. And we can also help you with that. But, it is not just the earnings that you've made from your current employer that you're taking leave from. Again, it's any New Jersey covered employment. So, being said, part-time workers would potentially be eligible once you hit these minimum earnings qualifications. Currently, you do have to have a valid Social Security number to apply. And yeah, I just want to reiterate the eligibility criteria for family leave insurance, temporary disability insurance, and unemployment are the same. So this description would apply for your eligibility for all three of those sort of safety net programs, financial support. Okay. I can go to the next slide and I will talk to you about what the benefit provides. So the amount that you will receive is 85% of your average weekly wage with a maximum weekly benefit of $1,119 for this year. That does adjust every year. The cap adjusts every year. The 85% was part of the expansion that went into effect in 2020. It used to only be provided at 66% of workers' average weekly wage, so that was raised. The benefit is sent via a money network card, but the money can be directly transferred online to your own bank account, so you don't incur any fees. And I do want to also note there are some delays with the state paying out claims. This is an area that we are continuing to advocate for change. We're looking, to the state to really modernize its processing system. It was built in the, I think, 80s and has not been updated. They've done a lot of really good work to modernize the interface on the website, the application itself, what you see when you go to apply, but the internal processing of claims can still be delayed. One of the top reasons for delays, though, is actually getting the medical certification in. If you don't get that in if your care provider doesn't get that in within 2 weeks of when you initiate your application, it will delay your claim. And that's one of the top reasons for delays. So that's something to be on top of if you need that medical certification. You don't need the medical certification if you're taking leave for bonding. I just want to note that. But otherwise, for caregiving for loved ones or for your own health, you do need that medical certification. The duration of benefits for your own health for disability is available for 26 weeks every 12-month period. And for family leave insurance for caregiving or bonding, it's 12 continuous weeks, or if you break it up into intermittent leave, it becomes available for every 8 weeks. Every 12-month period, either 8 intermittent weeks, or if you do it in day increments, you have 56 days. The process for intermittent application is also pretty burdensome. And I can give folks advice if you have questions about how to do the intermittent application. But it is a barrier that we're looking at, hopefully having the state improve the processing of claims when people want to take it on an intermittent basis, which is fairly common for folks that are wanting to take leave for caregiving reasons. So we can go to the next slide. So this is just where you would go to apply, myleavebenefits.nj.gov. The website has greatly improved over the last 8 years. The information that the state is providing, multiple languages, the ability to translate information, and then the claim itself does have the ability to see it in other languages. But this is the site that you go to apply. The advice that we give people is that you do not actually need to apply until you are in the window of not working, not receiving pay from your employer. You can start a draft application before you're on leave, but you actually can't submit it until you stop working. It's just essentially a draft. So our advice has now been, you can go on, you can check out all the information that you need. You can see what the process looks like. We can also give you one-on-one guidance and non-legal advice on our website, njtimetocare.com/get support. But generally, you don't actually submit your application until you stopped working. There may be some need to get your leave approved by your employer, and I'm going to talk about job protection in a minute. But as long as you meet the minimum earnings eligibility, you should be confident in your approval of your benefit. But we are always happy to kind of review that and discuss it with you so you can feel a little more confident about, what to anticipate. Okay.
Yarrow, we have a question that I think fits into this now. It's, if your loved one, if it's a very sudden thing where they get sick or injured and you don't have paid sick days,
Yeah.
can you get paid? Could you apply and then get paid retroactively?
Yeah, it's a good
Okay.
question. So technically on the website, it says to apply within 30 days. So if the incident happens, you unexpected stopped work, you didn't have benefits to cover you, or you actually decided you wanted to access your family leave insurance benefits and not receive or deduct any of your pay, if you have PTO or sick pay, you can actually do that within 30 days. But if the time frame is even beyond those 30 days, all you have to do is justify. There's a part on the application where you say, oh, this was an unexpected situation. I didn't even know perhaps about how to apply. I didn't get enough information from my employer, so I'm applying late. That should be fine. If you need assistance with kind of navigating that, again, we're happy to help. But yeah, as long as it's within 30 days or even beyond with an explanation. Now, there isn't a kind of clear cutoff, like if it was a year ago, that may be more difficult, but there isn't like a end date of when it's no longer possible. It just becomes a little more challenging. So I just have a few slides here to kind of give you all, a sense of the fact that we are still facing barriers for accessing this benefit for being able to access time off. You can see in the next slide, and you can actually go to the next one too, some of the statistics about awareness. We do find that only about half of workers are aware of family leave insurance, and that awareness actually increases as folks earn less. So the more that you need it, if you are a mid to lower earning individual, it's more likely that you don't know about it. So we do want to always impress upon you all here today, now that you know this information, consider yourself an ambassador. Share this out with your friends, with your family, with your coworkers. We really are wanting folks to be able to access this and address some of the challenges and barriers. One of the barriers is comprehension. People are confused. Everything I just described to you is complicated. This isn't something that you get a training one time and now you immediately know how you can access paid leave. I'm actually going to make it even more complicated in a minute when I talk about job protection. So the comprehension and understanding of paid leave is real. And so we're here to also help folks navigate that. And in the next slide, you can see, the fact that we still see the benefit is actually underused, particularly by those most likely to need it. From our last set of data, we know in 2023, there were about 4 million New Jersey workers covered by family leave insurance, but only just over 53,000 eligible claims were filed, which is pretty low. We are seeing an increase in access to the benefit as we've expanded how it protects people and who's eligible, but we still want to increase use because this is here for you. It's a benefit that you are contributing and paying for, so you should be able to access it. And in the next slide, this was some research that you'll see the Center for Women in Work interviewed folks. They have some quotes here from people talking about like the cultural stigma or the workplace stigma. The fact that people kind of question when you take leave, you may be judged as not, the best worker. But actually, the more that we take leave when we need it, the more that we talk about taking leave and how important it is for our own health, our own financial security, and our ability to then return back to work and be productive if that's what we need to do, the better our culture and our the way in which we look at leave will start to change. Excuse me. So next slide, just again, the pitch. The more you know, the more you can help and get the word out. So we're always here to help in that outreach, in that support of informing other organizations, other groups. So please do reach out and let us know. Before we kind of open it up for questions and answers, I'm going to throw some more information at you. So don't be intimidated by the amount of information I'm going to give you. But I do think it's important while I have the time to give you some more information. So in the next slide, you'll see some of what I'm going to cover now, which is what I mentioned before. Oh, I'm sorry. So okay, just let me explain what this is. So this slide and the next slide are actually a handout that we can provide that are tips if you are an intermediary, if you're working with members of the public, with patients, with loved ones, how you can understand getting this information out. So talking about how paid leave is important, that you don't have to be an expert. Just knowing some of the basics can help inform others. And in the next slide, you'll see more of what the flyer unpacks. The fact that job protection is separate, the eligibility is separate from the eligibility for our paid leave benefit, which I will tell you about in a second. How and when to apply. Again, that website, myleavebenefits.nj.gov. And what to do when benefits are delayed in the case where somebody is concerned, they maybe feel like they're not going to get paid, but how we can make sure that they do receive those benefits and advocate for that payment to happen. And then I have some QR codes on this flyer so that people can get more resources. So this is a flyer that we can share with individuals if this is helpful for you. Okay, so the next slide. So this is where I was going to unpack some related programs and laws, retaliation protections, job protections. I'll talk a little bit about earned sick days and other work rights. I'm going to go through these pretty fast just for the sake of time, but I wanted to share these with you, make sure you have the slides as well. So in the next slide, you'll see just the overview of retaliation and job protections. I mentioned before the Federal Family and Medical Leave Act. If you can, I don't know if you can go to the next slide. But FMLA, many people are familiar with, and they've heard about FMLA, and the employer often is giving you information about the FMLA because that is the federal law. Again, that's just the federal job protection law. But we also have a New Jersey Family Leave Act, or the FLA, which is a state law that protects a worker's job while they're on leave for caregiving and for bonding. So you have these two layers of job protection laws. And additionally, it is illegal for employers to retaliate against a worker for taking or seeking to take their TDI or FLI paid leave benefits. And you do have the right to take private legal action in instances where you think your rights are being violated. In the next slide, I have a chart for you that kind of breaks down what is the most complicated and confusing part of taking leave. So everything on the left in orange, what I've already described for you is the paid benefit or the wage replacement under TDI, temporary disability for your own health, and family leave insurance or FLI for caregiving or bonding. And these are like sort of the summary of everything I just described. To be eligible, you have to work in New Jersey. You have to have worked 20 weeks earning $310 or $15,500 in about the year and a half before you take leave. The size of your employer is irrelevant for your eligibility for wage replacement. On the right is job protection and where everyone gets confused. So don't be afraid of what I'm going to tell you here. The QR code and the link do take you to more information about job protections. And job protections in our state law are changing July 17th. But under FMLA, for job protection, for caring for a loved one, for your own health, as well as bonding, this is the federal job protection law. You do have to work at your employer for 12 months. You have to have worked at least 1,250 hours in those 12 months. And you have to have at least 50 employees within 75 miles to be eligible for FMLA coverage. Okay. If you don't meet that criteria, and you're taking leave for caregiving or bonding, you can look at the Family Leave Act to protect your job. Currently, you do have to work at your job a year. You have to have worked 1,000 hours in the last 12 months, and you have to have at least 30 employees worldwide, or you work for government, regardless of size. And that law will protect you if you meet that criteria. But it's actually getting stronger in a few months, July 17th. So we can go to the next slide. I know this is a lot of information, but these are resources to support you should you have questions. This is a summary of the expansions that are coming July 17th. We are still waiting for both the Department of Labor and the New Jersey Division of Civil Rights to issue information to the public. This is our interpretation of what the law that was passed and signed into law in January will do. So it will change what I just described for job protection under the Family Leave Act. You do not have to work at your employer for a year, 3 months. You have to have only worked, instead of the 1,000 hours, 250 hours. And you only have to have 15 or more employees at your employment to be covered starting July 17th. Family Leave Act only protects your job when you take leave for caregiving and for bonding. However, the law also did include job protection when you're taking TDI benefits, and we think maybe possibly when you're taking your family leave insurance benefits. We are waiting to get information from the state to confirm that. But this is the changes that we anticipate are coming very soon. So it can be confusing because employers often are saying to folks, oh, you're not eligible for paid leave. You haven't been at the job a year, because they're thinking about FMLA. And so the employer may actually say to you, you're not eligible for FMLA, but maybe they don't know about the Family Leave Act and the changes coming. So it's important for us to start to think about, is the employer, is HR sharing accurate information? Excuse me. And how can I make sure that I'm standing up for my rights and my ability to not risk losing my job? Now, that being said, if you are not eligible for job protected leave, either as it is currently or as it's expanding, you may still be entitled to and eligible for your paid leave benefit. And you could still take your paid leave benefit. Your employer could still decide to keep your job and allow you to return to your job. The law just doesn't require them to do that. And if they don't allow you to return to your job, you will not be penalized, because this is not an employer benefit. This is essentially a public policy benefit, the fact that you work in New Jersey. You are not required to necessarily go back to your employer when you need to take this time and access your benefit. Okay, I'm going to kind of wrap it up here, but a few more slides to share with you before we open it up to questions. At the beginning, we mentioned that we were able to pass the earned sick, and we call it actually safe leave law. So this is a law that requires all employers provide a minimum of 5 paid sick days a year, 40 hours. And this is to all workers, regardless of immigration status, that they have to pay workers directly. The employer can require that you earn the time, 30 hours that you work, you earn 1 hour. Or they can front load it and they can offer it to you at the beginning of the year. And the time can be used for your own health, illness or preventative healthcare visits, caring for loved ones, addressing issues related to domestic violence. If the workplace or the school place were to ever close due to a public health emergency, anything kind of related to a public health emergency. And also, in the next slide, I just want to mention for parents, if you have children in the school, you can use earned sick days for anything related to school meetings, school events. Excuse me. But then I also just want to always mention, it is broadly, everyone is covered, but the next slide will say who is not covered, and it's fairly limited. So union construction workers that have a collective bargaining agreement are not covered by this, per diem healthcare workers, and public employees who already receive sick leave in any sort of state law. And then again, independent contractors are carved out from this. Otherwise, earned sick leave law covers you and protects you, not only your full pay, but also your job being protected. And then I just want to share a few other important things to be aware of when it comes to work rights. In 2016, our minimum wage was raised every year. It's raised this year. It's 15.92. There are some exemptions. All workers have the right to be paid their full amount of wages owed for all hours worked, no less than the minimum wage. And as long as you're a non-salary worker, you have the right to overtime, 1.5 times your regular pay, anything over 40 hours a week. And then I mentioned here if you are misclassified as an independent contractor or paid cash off the books, you could be deprived of your rights, and misclassified employees may be entitled to financial awards. The next slide. For those of you that may have or know about domestic workers, or you employ a domestic worker, there are new protections for those workers. They have the right to breaks, discrimination protections, and a right to a contract. Also, temporary workers, folks that are employed through an agency, have additional protections as well. These are new laws that have been passed in the last couple of years to really address industries where there's been a lot of discrimination, and workers have actually have suffered. So these are protections to help ensure that they are entitled to some basic rights, basic protections. And then the last slide here before I quiz you is just to remind you, let you know about unemployment. If you're covered, as I described, for the minimum earnings as family leave insurance or temporary disability, and you lose your job or you can't work of no fault of your own, or your hours are reduced, no fault of your own, you could be entitled to unemployment. So this could even mean if you take family leave, you take temporary disability, but then actually you figure out you can't go back to work, it's not your fault. It's your health situation or a caregiving situation. You may be entitled to unemployment, which if you've already received some state benefits, either the disability or the family leave, it increases the maximum benefit. So it'll say, instead of the maximum benefit that you've been approved for family leave or disability, it's now that if you apply for unemployment and are approved, it'll be 1.5 times the maximum benefit. So it will extend your ability to access the safety net. It just does provide a little lower benefit amount. It's 60% with a cap of 905. And you do have to have a valid Social Security number. So that's just a little point of information. But now I'm going to quiz you. If you want to go to the next slide, and you can pop this in the chat, or I don't know if folks want to come off mute. It's up to you. How do you want to manage this? But the question, you stopped sharing the slide? Oh. It's up to you, Kathy, but I had a quiz. Do you have to work at your job for a year to be eligible for family leave or temporary disability insurance benefits? Payment, money. So pop that in the chat, or come off mute, or whoever wants to be put on the spot. Tell me what you think. Yes or no? Do you have to work at your job for 12 months to be eligible for family leave or temporary insurance benefits?
We have a brave person that put in yes. Someone else said no.
Ooh, okay. The reason I asked this question is because this is the most common misunderstanding. And so I don't I don't want to put you on the spot, but the answer is, next slide.
No.
You only have to meet the minimum earnings for your benefits, which is that 15,500, or the 20 weeks earning the 310 in those 20 weeks. But in a way, it's right if you're thinking about job protection, but job protection is separate, and it's changing in July. So the next slide, one more question for you. You have to have 50 employees where you work to be eligible for your paid leave or family leave or disability benefits. Excuse me. This is another tricky question for you. The devil's in the details here. 50 employees. What do you all think?
We have a no. I think it's yes, but it's about to change. I think I'm wrong on that. Oh,
Right.
somebody's with me.
Excuse me.
Okay, let's see. Oh,
Yes. So the trick
oh,
question
okay.
here is we were asking about your paid leave benefits. No, for the money, no. It's just that you met the minimum earnings and that you work in New Jersey, right? The size of your employer is irrelevant when it comes to being eligible for your paid leave or disability benefits for your money. Job protection, and if you want to make sure you have a job to go back to, which most people do, it is a factor. So it is understandable why people think the answer is yes. But it is important to understand the distinction that it is changing. You have to have 30 employees when you're talking about family leave, caregiving. And in July, it's being lowered to 15. And we think if you're taking leave for your own health and you're accessing temporary disability insurance, your job will also be protected. So, some really important strengthening happening soon. So, stay tuned for more on that. So, I just have a few other slides to share, some links with you. If I don't know if you're planning on getting the slides out or a link to the slides, but you can see some other. I already mentioned the website you go to apply or get more information on the Department of Labor, our Get Support referral line. And then also just if you need to sign up for a workshop or training, we're happy to do that, whether it's in person, online, English, Spanish, during the day, at night, we are available. We always are looking for people who are interested in sharing their stories and getting involved, and some links there. And then I like to just share some visual of some of the resources and handouts at the Department of Labor. On the next slide, you can see a wealth of materials that the Department of Labor prints for free. If you are interested in receiving any of these physical copies or even the links online, you can see the link there. But always happy to connect you to more resources, know your rights. And in conclusion, I just always make sure people have the link to where you sign up to get free presentations and trainings. And I'm happy to open it up for questions.
Okay. And we will share the recording, the slides, and I'll also download those links and put it in the email so people can find it more easily. But I want to thank you. As Yarrow knows, every time we meet, this is one of my favorite, I think, most important programs in New Jersey, but it is underutilized. Like you showed with the numbers of how many, like 56,000 or so actually use it. And especially as we have an aging population, more and and there is a shortage of home care workers to take care of people. So even if you can afford to pay for a home aide to take care of a loved one, you might really have a hard time finding one, especially, in some parts of the state. So it's important that we understand and share and tell other people about this so they can take that opportunity. And one of the great examples that I know of, I have a friend who they rotated care for their aging mother. So they took their turn. They had four siblings, and they each took their 12 week turn. And so that their mother could stay in their home, had full coverage, always had someone there. And I thought that was a really creative way for the family to do it. But they all were in New Jersey. They all knew how to work. The mother didn't live in New Jersey. But I thought that was a really great example on how families can use this to cover the care needs, especially
And
we're talking about
now
older
that
adults.
they if they had the additional loved one that maybe not be a family member, they could even see about
True,
having them help. But yeah,
true,
that's great.
true.
I just wanted to say I shared a great fact sheet that talks about paid family leave and the support, how it supports the health and well-being of
Okay.
older adults and their caregivers. But I did see the question here about FMLA and FLA covering union construction workers. The only exemption that I'm aware of for union construction workers that have a collective bargain agreement is earned sick leave. So I'm not familiar of an exemption specifically for union construction workers in terms of job protection. Um, But I'm always happy to kind of talk about the details. If you want to access the Get Support link, you can set up a one-on-one appointment with me. But generally speaking, FMLA and FLA does cover the majority of folks, and then the exemptions that I described in the slides.
And it sounds too like if people aren't sure, because there are some things do get lost in the details, that to go to the websites, ask questions, get a one-on-one help that will help people figure out what, when, how, all of that.
Mm-hmm. Yeah, but I'm happy if anyone wants to come off mute. We have a few minutes left.
Either you answered everything or people are processing.
Hi,
Good.
good morning. So I did ask a question in the chat um, about if you don't have sick time or vacation time and you have a chronic illness and you miss a lot of days due to appointments and just not feeling well overall, if you can use the NJFMLA to cover those times.
Yes. So I think first I want to just mention there's very few exemptions for earned sick leave now. An employer may have their PTO set up so that it includes earned sick time, and that I can get into. But you go through those 40 hours pretty quickly if you need to take time off. And so if for whatever reason you aren't covered in the earned sick leave law or you don't have enough of the time available, yes, you should be able to do two things. Look at Family Leave Act or FMLA. Both of them would cover you for your own, both of them would cover you for caregiving. But for your own health, it would only be FMLA or the expanded job protection under TDI. TDI is the benefit, temporary disability insurance, that you would be accessing. If you don't have pay and you need pay, it would be through that program that you'd be applying for your benefit. If you need it intermittently, you can do that. However, it isn't a simple process, and I can help coach you if that's something that you need to access. But yes, the answer is yes.
I would appreciate the coaching.
Yeah, so to be honest, it's if you're looking at trying to navigate this situation currently, definitely set up an appointment. So I put that link in the chat. It gets support. You can sign up. I have two things. Pick a time on the calendar, and you also then fill out a questionnaire for me, and then I can definitely chat with you. Can an employer make you use your earned sick time while on TDI or FLI? So right now, before you access TDI for your own health, they can actually have you exhaust your time, but not for family leave insurance, not for taking time off for caregiving. They can't make you take your own time. This is part of the expansion and a nuance of the law. Does the illness have to be considered a disability, or can it be something as simple as a bad cold or flu? So for earned sick leave, it can be anything, right? You actually don't even need, the employer can't even request a doctor's note unless you're out 3 consecutive days. So you can just call out sick for earned sick leave. But that's just those 5 days. So if it goes beyond, you do need to look at your medical care provider, your doctor, and their willingness to certify you needing more time off. A bad cold or flu typically doesn't qualify you, but it could mean that you are looking for a diagnosis, right? You're in the process of trying to get your doctor to figure out what you're dealing with. And in that case, you could potentially be accessing the benefit. It kind of really is reliant on that, in that situation, on your care provider. So having a conversation with your care provider, and sometimes you do need to educate your care provider. There's, again, the resources on the Department of Labor's website actually specifically for care providers so that they know and they feel confident about how to help you. I think I just wanted to see this one question. Can sick time accrual be prorated for part-time workers? 40 hours per year mandatory. It just means if you work part-time, you're earning it slower. Because again, it's every 30 hours work, you earn 1 hour. And then once you hit the 40 hours, your employer doesn't have to give you any more than that. You may actually be accruing more than that, but they don't have to allow you to take more than 40 hours a year.
So a lot of it comes down to your employer and what they offer employees? Are they doing the minimum that they're required to do, or are they
Right.
offering more? Okay.
Earned sick leave we think of as a floor. It's the minimum of what an employer has to do.
Mhm.
So a lot of workers are receiving more, but this was really meant to close the gap where before they had nothing and they would get the flu and they'd feel pressured to go to work because their employer had nothing. Yeah.
So I think that is it for the questions. I want to thank Yarrow again for joining us and for all of you for attending. As she said, you are now ambassadors, so please use this benefit, talk about it, tell other people about it because it's, I joke that it's New Jersey's best kept secret, but we are really fortunate that New Jersey goes above and beyond the federal requirements. And this is something that is in place for all of us. The insurance is a New Jersey program, so we don't have to worry about it being cut with other services and
That's
funding being
right.
cut at the federal level. This is New Jersey benefit. You are paying for it, and we really want people to learn more and to start using it. So thank you, everybody. We will be sending you the links, the slides, all sorts of stuff so that you can look at it in more detail. And also, please share it wherever you can so that we can have more people take advantage of this. Thanks,
Thank you,
everybody.
everyone. Thank you, Kathy.